Welcome to Eye Care Central. In this video, we will learn the difference between hydrodissection and hydrodelineation. Both of these are hydro procedures that are routinely performed during cataract surgery. So the density of a cataract increases from its center to its periphery. And based on this, we can divide the lens into three surgical zones. In the center is the densest part, which is the endonucleus. Surrounding the endonucleus is the epinucleus. And the most peripheral part that lies directly underneath the lens capsule is the lens cortex. Endonucleus and epinucleus together form the lens nucleus. So suppose we are doing cataract surgery. In this case, we have made the corneal incisions and we have made the capsular excess. Now it is time for our hydro procedures. In hydrodissection, we separate the cortex from the capsule. So we take saline in a syringe and we take our cannula under the rhexis margin and we inject saline. This creates a wave of fluid that loosens the cortex from the capsule. This makes the step of cortical aspiration pretty easy, which is done after the emulsification of the nucleus. Hydrodelineation is the process in which we separate epinucleus from endonucleus. So instead of going under the rhexis margin like we do in hydrodissection, we take our cannula into the superficial substance of the nucleus and then we inject fluid. This separates the endonucleus from the epinucleus and this is what we call hydrodelineation. So the most important application of this knowledge is in a case of posterior polar cataract. As the name suggests, posterior polar cataract is present right at the posterior pole of the lens. It is often associated with an accompanying defect in the posterior capsule, which means that after we remove the cataract, instead of finding an intact posterior capsule as we normally do in a routine cataract surgery, what we encounter is a pre-existing defect in the posterior capsule. So while doing cataract surgery in a posterior polar cataract, if we perform hydrodissection, the jet of fluid would open up this defect and there is a chance of the entire nucleus dropping into the vitreous cavity, which is obviously one complication that any cataract surgeon would want to avoid. Thus, while planning surgery in posterior polar cataract, we must remember not to do hydrodissection. We only do hydrodelineation in such cases so that the endonucleus separates from the epinucleus, the posterior capsular defect stays sealed, and we can comfortably remove the major part of the lens nucleus without disturbing the posterior layers and thus preventing the complication of a lens drop. Then the question arises, why do we do hydrodelineation anyway? So by doing hydrodelineation, we debulk the nucleus. We separate it into layers and it is easier to remove it in layers and it reduces the phacoenergy that is dispensed during cataract surgery because we use our phacoenergy majorly to emulsify the endonucleus. Secondly, the epinucleus that has been separated, it acts like a cushion. It keeps the posterior capsule away from your phacoprobe and reduces the chance of a posterior capsular rupture. That is the reason why phacoemulsification is considered a little difficult in advanced cataracts like brown cataracts and mature cataracts, because in these cases the entire nucleus has become sclerosed. There is no distinction between endonucleus and epinucleus and we don't have an epinucleus sheet to keep the posterior capsule away. So that is all for this video. Please like and share this video with your friends and colleagues if you found it useful, and please subscribe to my channel to support free education. Thank you very much.